Hi, Penny Myers here. I want to talk a little bit more about the medication and things that affect survivors of suicide loss during their grief, their pain, their loss. It's not depression. Sometimes it's mistaken, confused, and unknown the difference between grief and depression. But honestly, when it comes to grief and loss by suicide loss, why is it not considered to take or to give THC or CBD? I know very little about this whole field of CBD and THC. I know very little about the effects, the understanding of it. What I know about it is the calmness, the relaxed feeling a person has, the fact that you can still think when you're on it. It doesn't disrupt your ability to think clearly and know what you're doing. I also know that THC and CBD, either taken in combination of both, a little different levels. I don't know, and I'm not going to get into that. But I also know that huge calmness and yet awareness of one person. You're not out of it. You're not floating in a cloud. We're not talking about a high. We're talking about manageable symptoms. I'm talking about when you have no aches and pains, no physical aches and pains, no emotional aches and pains. There is a difference. Why is that not considered where medication given for depression, any kind of mental unstableness, you can't function? You can't think right. I've not had it. I've not experienced the medication for any kind of emotional disruption, emotional outbursts, anything. And I've had my share, trust me, I've had my share over my lifetime. I've wrote books on my upbringing in my childhood. I had left home at age 14. Talk about distress and stress as a teenager, being brought up in a physical, mental, verbal abuse. I have had my share of emotional turmoil. And no, I have not tried any medication. But why is THC and CBD so looked upon as inappropriate? Our doctors can't and won't discuss it or write prescriptions. A naturopath will not. So why is that not considered? There's somewhat of a, I thought I understood with THC and CBD, there's a natural in our system. It's in our system. That's why it works so well. I don't know what it is, but I do know people are afraid of it, fearful of it, and I don't know why. What have I tried? Very little. And I'm quite impressed and pleased with it. I have never had a high. I have never taken any kind of cannabis as a child or a teenager in my past. It beats alcohol. I think it's open for discussion, and I'd like to know more about it. So if you know anything about it, share. Like I said, I'm not talking about getting high. I don't need a high. I just need to function. And that's what people tell me. I just need to be able to function. That's all. Okay, more on that later. Okay, I'm sure there will be a part 2. Don't forget to subscribe, share, like, and comment. Thanks a lot. Have a great day. Bye.